I'm doing research on the environmental context that young children grow up in, their families, the daycares that they attend, the schools that they attend, and the neighborhoods that they live in. And we're interested in how all those environmental contexts affect the development of young children, particularly around the emotions that they have and how they come to understand other people and how they get good at controlling their emotions and expressing their emotions and working with other people as they grow up, because that's been shown to be really important for how adult lives develop. Well, I started as a clinical psychologist. That was, I guess, around 1980. I worked for a while with children and families in different clinical settings, and I realized while working in those clinical settings that what was incredibly important was really trying to prevent the kinds of problems that start up with children and then get very complicated in their lives as they develop poor relationships with friends and parents and other people. And so I wanted to be able to understand what the factors were that led to the development of those kinds of problems. Well, we're really learning about the importance of the family relationships, how parents and kids negotiate difficulties that they've got, and how those influence all aspects of learning in kids. So we can think about it from the point of view of how they come to understand other people, but also the emotional and behavioral problems that they develop, also their reading. We have lots of different indications of what kind of supportive family environments really confer the best chances on children. It's not just the family environment. Children bring their own preconditions to that family environment. Some kids are more temperamentally difficult, some kids are shyer, some children have less good attention skills, some kids have less good language skills. And I think we need to recognize the individual differences that are important, that then play into how easy it is to parent those kids in the home and how easy it is for teachers to work with those children and kids in school settings. Well, I think it's very important for those of us who do what we'd call observational studies, where we try and understand the pattern of factors that affect children's well-being and their health. Well, CIHR funding has just been fantastic for me. I've got a big team of people that I'm working with. As I've been able to work across many different disciplines in the work that I'm doing now just because of CIHR. So I put together a team of people, of an epidemiologist, of a geneticist, of psychologists who work in later childhood and psychologists who work in early childhood, and people from public health. And by putting this whole, CIHR gave me the opportunity to put this team together, and that's been a terrific learning experience for me.